refer to as a dislocated thumb. Now, what happens to the dislocated thumb is that whenever the joint separates, in order for it to separate, the ligaments that hold it together have to be damaged or injured, so to speak. So he either sprained those ligaments. Worst case scenario, there's a possibility that he might have completely ruptured those ligaments. And if that's the case, oftentimes they require surgery. So I think from the reports that I'm hearing out there is that he's not in that area there, or at least they're trying to avoid the surgery. So it becomes a little tricky type of thing. There may be a point that he may get that, hey, you know what, this is not getting better, and they have to resort for surgery, and they're going to go ahead and resort for surgery. But I think he's trying to hold off and see if it gets better. Now, the bigger issue is that if this was a running back, if this was a lineman, both or defensive lineman or defensive tackle or linebacker, all they would do is just tape the thumb, wrap it up, stabilize it, and go. Put a glove over it, and he's ready to go. Unfortunately, as a quarterback, just like as a wide receiver, you need to feel the football. You need to be able to kind of grip and that part. And as most of you guys know, one thing that makes us, as far as humans, different from kind of the majority of the animal world is that we have what they consider the thumb, and that is one of our main components. If you eliminate your thumb, if you go try to do a curl, you try to do a curl out there at the gym, or you try to do a pull up or something like that, and don't use your thumb, it becomes very difficult. So for a quarterback to get that spin, they need that thumb. So right now, this biggest issue is controlling the swelling, make sure that the pain is down, and see how he feels when he grips the ball. That's going to be the deciding factor. If he can grip the ball and throw the ball, then he's ready to play type of thing. Even though the injury hasn't completely resolved, he's able to do that. So that's going to be the deciding factor for Justin Fields right now. So as far as timeline, unfortunately, there is no timeline for that. It could be, I mean, he could wake up Thursday, Friday, say he feels great, I can throw the ball, I'm ready to roll, or it can take a few more weeks type of thing.
Another name I'm going to throw out you. We didn't catch this prior to putting the record button. Justin Jefferson from the Vikings will miss 4 to 6 weeks with a hamstring injury. Can you explain that?
Yeah. So let's go and talk about just Jefferson. So most of you guys have probably seen, if you do fantasy football or just watch football in general, hamstring injuries, and it's something that I've kind of reported. We talked about this. Hamstring injuries are very, very tricky as far as coming back. Everybody's slightly different. Now, the typical timeline so let me back up a look. Usually hamstring injuries are categorized in 3 degrees: first, second, and third degree. A first degree hamstring strain is like, hey, I just kind of tweaked it. It feels uncomfortable. It doesn't feel that bad type of thing. I can kind of still move and I'm ready to go. Usually that takes anywhere between 7 to about 14 days to return to activity that you feel pretty good. But even then, a first degree hamstring, you might feel great, but you do a move or you accelerate, decelerate, and then you can kind of aggravate it. That's kind of what happened with Keenan Allen last year when he tried coming back in about a week or so, and he said he felt great, and then he was out for about 8 weeks. Now, with Justin Jefferson, the fact that they've already categorized him out 4 to 6 weeks, that tells me that he probably has a second-degree hamstring strain. So that usually takes a little bit longer. It's going to take a little bit longer for heal, okay? And the other issue with him, and there's other factors that kind of involved also when you return and play, is that he does not have I believe he doesn't have a contract, or he declined the contract, the extension for next year, because he wanted to see where I think Kirk Cousins was going to play type of thing. So that's one. Two also is, I think at some point, although the Vikings won again on Monday night against the 49ers, if the Vikings were starting to kind of decline and they weren't winning, the incentive for Justin Jefferson to come back and make that worse, rupture the tendon or something of that sort, it increases. So the odds of him coming back, he's going to probably be more conservative type of thing to come back. So it's just a matter of waiting and seeing how the Vikings are doing. If the Vikings are winning, okay, can Jefferson come back and help them even win further and get into the playoffs type of thing? Or is he going to kind of just sit out and, hey, you know what, I'm going to call it the season and get healthy, make sure I get my money for next year, and then kind of roll next year. So his situation, like I said, most of the times when injuries occur, it always comes down to what I've always said, the risk reward. What is the reward for him to come back versus what is the risk? If the risk is a lot higher than the reward, most players are like, hey, you know what, I'm not willing to risk it. If the reward's a lot higher than the risk, then by all means, let's go ahead and do it. So it's just a matter of waiting and seeing what the Vikings are doing, how he's feeling. But yeah, he's definitely going to be out minimum 4 weeks, because he's already on IR. But I expect him probably out closer to the 6 weeks, if not 8-week mark.
So I got one more curveball for you. We have to talk about the rookie quarterback from the Colts, right? Shoulder injury, underwent successful surgery to address a grade 3 AC joint sprain in his right shoulder, according to the owner, Jim Irsay. Just thoughts on that?
Yeah. So that's again, this is another issue as far as it's a young quarterback. So an AC sprain is basically you have the clavicle right up here, and then where the clavicle kind of connects with the shoulder. When you fall on it, and if you go back to the video, you see that he kind of falls on it, and then the defensive lineman kind of falls on him on top of him, so that's additional weight. So when you have someone has what's called an AC separation, you'll see the clavicle bone pop up. So it'll look something like literally like this when they put a t-shirt, you'll see it up here floating, and if you push down on it, it'll just pop back up. Push down on it, pop back up. So there's a total of 6 grades for an AC sprain, but normally they just use top 3. First one, he just sprained it. If you guys recall, Derek Carr kind of had that back then. He's out here not playing. A grade 2 is kind of moderate. A grade 3 indicates that all the ligaments pretty much have ruptured and nothing's holding that clavicle in place besides the skin and some muscles, and it'll be floating kind of right up here type of thing. Now, I think they were kind of deciding what they were going to do. Were they going to just kind of let it kind of sit, see if it heals on its own, and then try to come back? But I think I read some of the reports is that that the Colts and Anthony Richardson decided to proceed with the surgery based on some of the incidents and situations that happened to their previous quarterback, which was Andrew Luck. If you recall, Andrew Luck didn't have the AC sprain. He had a labrum tear. He opted not to have surgery. They rehabbed it, and then he started having issues with it, and then it prolonged. I think in this case, because it is a young quarterback, he's considered the franchise player for upcoming. They were willing, hey, you know what? Forget the season. Let's get you healthy. Let's get you right. Let's get the surgery done and be ready for next year type of thing. Also, just like Andrew Luck had the issues, is that if you don't have the surgery, and this is not always happens, but he had a little bit of complications. He probably had a little arthritic issues there, some inflammation, and it became a big roller coaster for Andrew Luck that I think from at some point he either got frustrated, and I wouldn't be surprised if that was attributed a little bit to him deciding, you know what, I'm going to retire. This is too much of a headache type of thing. Yeah. So Anthony Richardson, rehab usually takes for him to return to activities probably about 4 to 6 months type of thing, which is well into the season. So he'll be out, but you expect a full recovery and be ready to go for next year.
Because I know LeBron did his weekly pick'ems and things of that nature, in which Anthony, the best if he decided to pick surgery, which he obviously did, or just do the rehab. Which obviously he's going to have to do anyway, but you might as well do the surgery and rehab is what you're saying, basically.
Correct. Yeah. So the option number 1 is just, hey, let's see if it heals on its own. Let's go ahead and do rehab and kind of goes in the part, which the fact at grade 3, it can, but the likelihood of it happening are pretty low, and it's going to be a big issue. The other thing also is that if he waits and lets it heal and then he starts having complications, it can potentially linger into next year. Just kind of what happened with Andrew Luck. So now, not only are you wasting this season, there's a chance that you may be
tapping in the next season as well. Yep.
Right. And then he may have to have surgery like sometime, in December or something like that, or in January, that, hey, it's not healing, it's not feeling right, let's go ahead and have surgery. Which then that having surgery then in January or December, it's definitely going to go spill into next season type of thing. So it's one that's like, hey, have it now, let's get it done and be ready for next year.
Okay, I'm done with my list of throw-ins. You have a list of players that we discussed prior to turning on the recording.
Yeah, so we're going to talk about a former Green Bay Packers and a Green Bay Packers. So we're going to go with Aaron Rodgers now with the New York Jets. So there's a lot of talks about Aaron Rodgers and his Achilles tendon surgery, or the procedure, or his rehab, or the technique that they utilized. They did a lot of stem cell. I know there were mentions about that the procedure that they've done was kind of state of the art, brand new. He's actually jogging and moving around, which is great. And it, it's not a big surprise with technology and advances. That's the whole thing about, back then an Achilles tendon rupture would take a 4 year for you to come back. Even I think Cam Akers 2 years ago was able to come back, did it preseason, was able to come back towards the end of the season type of thing. So
Plum did it in 10 months, I think, if I'm not mistaken. She did a 10-month stint after her ACL tear with the Aces a couple years ago.
Exactly. So with technology, new devices, stem cell research, all this stuff, the healing process it's more advanced than compared to about 10, 15 years ago. So it doesn't surprise me. Now, the only issue is, Aaron Rodgers has some positives and negatives. Okay, if he does decide to come back this season. One, he is a lot older, compared to the young athlete. So that may contribute to some of the issues that he may have if he tries to come back a little bit earlier than later. But two, one of the positives is that he's not a running quarterback. He's a throwing quarterback. So for him to sit there, and then three, it's on the non-dominant leg as far as when it comes to throwing mechanics for him. So that's the other positive for him. So as long as he doesn't have to scramble and he kind of stays in the pocket, I can see him kind of coming back. But then at the end of the day, depends on how the Jets are doing. I mean, if the Jets are 2-9 by the time he comes back, or 2-10, is there a reason for him to come back or wait till next year type of thing? So again, it comes out to the risk reward type of thing. I mean, it's great that he's moving out there. I think I read reports that he's actually was throwing out on the field, felt pretty good type of thing. So he's kind of ahead of schedule, which is great. But the question is, does he want to come back if the Jets are, I don't know, 3-10?
They're 500 right now. They're 3-3. But getting back into the Rodgers thing, with this new treatment, right? You said it's kind of in the beta. He's a test dummy for this, right? It's basically what I heard on the news, because it hasn't been done before. What's the timeline for his return if he comes back, like without any setbacks? I guess you could say.
So but here's the thing that we don't know, because it's a new procedure that there is no set timeline. I guess Aaron Rodgers is going to set what's considered the timeline. Timeline, yeah. So when he comes back, that's going to be now the standard. So now people are like, well, he came back in 4 months, so I'm gonna come back in 4 months. Where traditionally, an Achilles tendon rupture is about a minimum about 6 to 8 months type of thing. Now, if he breaks that timeline, he comes back in 4 to 6 months, or comes back in 3 months. So then that's going to become the new timeline for everybody. I mean, I remember several years ago, Adrian Peterson, when he had the ACL, before it was like almost like anywhere from 9 to 14 months for an ACL injury to come back. I mean, Adrian Peterson came back and blew it up, went off, and all of a sudden he became the standard. Athletes like, well, he came back next year and he went off, so I should be able to do the same thing. So there's a few anomalies type of things. So like I said, there is no official timeline, because like I said, Aaron Rodgers is going to set the timeline. If he comes back early, then that's going to be the new standard.
I got you.
Yeah.
So you said for current. We're also talking about a current Packer as well.
Christian Watson. We're talking about Christian Watson, wide receiver for the Green Bay Packers. Now he's had several issues over the last 2 years, specifically with his hamstring injuries. I think last year he was out with it. This year, again, same thing. He didn't start the season with the hamstring injuries. He's had several of them, so he's kind of been injury prone with the hamstring. But also, he finally came back. I think he came back last week. He played this week. Also, he increased his reps type of thing. But he was also left, I think, at the very end. I believe you mentioned it was the last play of the game where he had a knee issue. They haven't mentioned what the knee issue is, so it's just a matter of trying to wait and see. Two, the question is if it becomes if it was more of a compensation pattern in that part that he resorted, and that's where the knee issue kind of came on, or it was just a fluke type of thing. So it's just a matter of waiting and seeing and see how he does if he returns to practice.
Okay.
Yeah. All right, so we're going to move on. We're going to talk about David Montgomery, running back with the Detroit Lions. Now, he is a little interesting because he is not your typical rib fracture like you normally do. He actually, what they identified is that he has a fracture to the rib cartilage. So there's two differences. So the ribs are, if you feel to the side of your, or you feel your ribs on the side, that's where the hard bone is. Okay. If you go more towards the front chest, that is where the cartilage is. So in cartilage, it's just fibrous tissue, kind of thick fibrous tissue, but it's not bone. It's not dense. It's not bone, basically. Now, one of the downsides to fracturing your cartilage is that there's very low blood supply compared to the bone. And if there's low blood supply, the healing effect or the process of healing or the timeline is a lot higher than if you were to do it on the bone. Just like if you strain your hamstring muscle, you have plenty of blood supplies to that area, which is going to heal it. But if you strain your tendon that has low blood supply, then the healing process is going to take a little bit longer. So this is a little bit tricky for him type of thing. And the timeline hasn't been officially set because you don't know the timeline. It's just a matter of waiting and seeing and see how long the cartilage heals. I wouldn't be surprised if you went ahead and had like something like a PRP procedure that you put blood in there to try to kind of create the healing process, trying to create the inflammation process so it can kind of heal type of thing. Where if it was just a bone, you just give it time and it will heal type of thing. Now, the other downside when you do fracture your rib or your cartilage, anytime you breathe, you're going to have discomfort. Anytime you rotate, you're going to have discomfort. Anytime you get hit, you're going to have discomfort type of thing. T. Higgins kind of had this injury a couple of weeks ago, but it was to the rib, not necessarily to the cartilage. So he was able to come back a little quicker because he was able to heal, and he was able to play type of thing. Although I think he hasn't been his normal self. It's going to take a little time for him to kind of return to his normal self. All right, we're going to move on over to the Cleveland Browns. We're going to talk about Deshaun Watson. This was a little tricky also. If you were fantasy owners and you kind of plugged him into play, I think he only played one series and then he was out for the rest of the game type of thing. Now, he originally was out already for 2 weeks for a shoulder, what they call a shoulder. I think they categorized it a contusion to his rotator cuff muscle. So the muscle wasn't torn. There was nothing going on with the labrum, and there was nothing going on with the joint. But when you bruise your muscle, you still have discomfort anytime you use that muscle. If you ever had like what's called a Charlie horse, or you hit your quad,
Yep.
And you can walk it off, but anytime you use that muscle, whether you walk upstairs, downstairs, you're going to feel some discomfort. Now, as a quarterback, it was to his throwing shoulder. If it was to his non-throwing shoulder, there would have been no issue. He would have been out there type of thing. Now, the interesting part about this is that he got hit. His head, I think, kind of whipped back, and they were assessing him for a concussion. Now, from my understanding is that they cleared him from having concussion. He was able to return, but the report out there was that the head coach wanted to be very conservative, and kind of for precautionary reasons, they decided not to put him back in there. So I don't know whether the shoulder issue was bugging him when he was out there. Was it really the concussion issue? Nobody actually knows as far as what was going on, but I think he's expected to return to practice, and he's expected to be available for this upcoming weekend.
Because I know Brady Quinn, the former quarterback for the Browns, called him out on Twitter saying that he didn't want to play anymore. So after he got paid the $400 million guaranteed too. So I mean, there's a lot of storylines in regards to Deshaun Watson. And if this tweet is true, I'm not going to read it, on the what's it called, but he referenced his legal troubles from a couple years ago. Let's just put it that way in the tweet.
Yeah, it's funny because I think I was watching a fantasy football show this morning, and they kind of mentioned something that sort that they paid him it was like a 5-year, 4-year guaranteed money, and it's set.
And nobody's come close to any of that. Nobody's come close to that number at all for guaranteed money.
So, and it's the Cleveland Browns, so they haven't been able to get a break with Nick Chubb going on in IR, now Deshaun Watson having issues, and their backup running back, Jerome Ford, which we're actually going to talk about right now, so might as well go right into Jerome Ford.
Yeah.
So the backup running back, the young buck Jerome Ford, that kind of took over Nick Chubb, and actually has had two great games. I think he had like an 80-yard run or something that sort this past weekend, but then he left pretty quickly with an ankle sprain. Now, on the positive thing is that they haven't put him on IR, which tells me that he probably has a mild ankle sprain. Usually a mild ankle sprain can take anywhere between, 1 to 2 weeks to kind of be able to return to play type of thing. So he's definitely out for this. I think they have him as doubtful for this weekend. Yep. But I expect him to be out. I think they have him as doubtful because they want to see if he does recuperate. For some reason, he has a miraculous recovery, then he's available. But don't expect him to be out there. I expect.
Yeah, it's a high ankle sprain. I don't expect him to play.
Oh, it's a high ankle sprain. Oh,
yeah.
I thought it was a common
ankle. Running back for 1 to 2 weeks. Yeah, he's out. It says doubtful, but he's out for 2 weeks.
Okay. Well, here's the thing though. If it is a high ankle sprain, he's out for more than 1 to 2 weeks. High ankle sprains should take about 4 to 6 weeks. So I'm surprised that they haven't put him on IR yet. Because that's the same thing that happened with Khalil Herbert. Now, they may be doing the same thing.
You mean Justin Herbert, right?
No, running back with the Chicago Bears.
Okay.
So he's on IR right now. Now, Khalil Herbert, they mentioned that he had a sprained ankle, and it was like a week ago, and they had him doubtful for the whole week. And then I think on Saturday, right before Sunday, they actually put him on IR because he had a high ankle sprain. That's what I mentioned. High ankle sprains can take anywhere from 4 to 6 weeks to come back from a high ankle sprain. It's rare that you're going to come back from a 1 week or a 2 weeks. So if Jerome Ford does have a high ankle sprain and he is doubtful, I wouldn't be surprised he's out for another minimum 3 to 4 weeks type of thing. So we'll wait and see. I'm surprised that they actually haven't put him on IR yet.
Yeah, they're probably trying to figure out if it comes down, he can still be available type thing, and it's not a guarantee that they put him on the IR. He has to miss 4 to 6 weeks, so you know how that goes.
Correct.
Who do we got next? We're gonna
talk about. We're gonna go to the New York Giants. 2 New York Giants. We're gonna talk about Saquon Barkley
and Daniel Jones. Correct.
So Saquon Barkley, I believe, the report was that he hyperextended his elbow. But he's expected to play on this upcoming weekend. That's actually a positive thing. When it comes to hyperextended elbow, you kind of just like when you hyperextend your knee, you may get a little bit of a bone bruise, or you may sprain a ligament or two in your elbow. Now, one of the great things out there is that they have plenty of braces that you can definitely wear to try to reduce from any re-injury or from hyperextending your elbow again. So I expect him to be able to participate and play. He may not participate in practice, but a veteran like Saquon Barkley, it doesn't surprise me. Just like with Christian McCaffrey this upcoming weekend, he played on Monday. He didn't practice all week. I think he just practiced, on Sunday or Saturday, and he was ready to play. So that's very common with veteran athletes, whether it's in the NBA or the NFL, is that they don't need to practice the whole week, but they'll be ready to play for the weekend. So if you have Saquon Barkley, expect him to be able to in your lineup for this upcoming weekend. Now, the quarterback, Daniel Jones, I think had a neck issue, which I wouldn't be surprised if he had what they refer to as what's commonly known as a whiplash. So he probably had a little bit of a neck strain on that part where you have difficulty kind of rotating your neck. So if you ever had whiplash, it is uncomfortable. It's just a matter of trying to get the muscle to calm down and relax and be able to increase some of that range of motion movement on that part. The reports out there is that he's actually feeling better and he's actually expected to return to play this upcoming week.
He's questionable for this weekend's game.
Yeah, correct. So they still have him as questionable. So unless he has any setbacks, he should be on. He should be in the lineup, and he should be able to be available for this upcoming weekend. So expect him to have that questionable title removed, hopefully by Friday or Saturday once he gets a full practice. So just if you do have Daniel Jones as your quarterback for your fantasy football, just kind of keep an eye on him. And like I said, as long as he has a full practice by Friday, he should be set to go for Sunday.
Okay.
All right, now we're going to go with the one of the Giants' rivals, the 49ers. We're going to talk about Deebo Samuel. So Deebo Samuel has had several injuries this year, unfortunately, and one of the issues that he did not play this past weekend is because they categorized him with, I believe, a hairline fracture to his shoulder. Now, the interesting part about it, hairline fractures are also known as stress fractures, and what that means is that you see a small little crack in the bone, but the crack doesn't go all the way through like a normal fracture where the bone's completely broken. Now, the concern with the hairline fracture is that it can potentially lead to a full fracture where the bone completely breaks. So they have to be very conservative with that. And the way they do this is they do an x-ray to kind of monitor the fracture, and they'll go further as far as doing a bone scan to identify the density of that bone. And they want to make sure that they don't see any fracture or any separation whatsoever in that bone before he's able to clear it to play. So it's getting pretty much the wait and seeing game with him. And I know they've categorized him out as 1 to 2 weeks. A normal fracture takes anywhere between 4 to 6 weeks to heal on its own. That's the average time. It can take longer, it can take potentially less. So I expect him out definitely probably minimum the 2 weeks. I don't expect him out this weekend, but hopefully if the hairline fracture does resolve itself and it does heal, maybe hopefully in the following weekend, if not the one after that.
Who's next?
Jalen Hurts.
Jalen Hurts, yes, the Eagles quarterback.
Mm-hmm. So they haven't really said what's going on with them. The interesting part about it, and I think it was a little bit of an issue. So Jalen Hurts and the Philadelphia Eagles played the Miami Dolphins on Sunday Night Football. During halftime, after the half, when they came back out, everybody knows that Jalen Hurts was all of a sudden wearing a knee brace. And they asked him, what was going on. He kind of dodged the question after the game. He didn't say anything. He just said he'll be okay, type of thing. So what that tells me is that either he tweaked his knee. Now, he was able to play. He was mobile. He was everything. So there wasn't nothing there. So either one, he just kind of tweaked it, had a little discomfort. Mm-hmm. And the sports medicine staff decided to put a knee brace on him just as precautionary reasons to make sure it doesn't become something actually bigger than that. But the fact that he was able to play with the knee brace, he was able to play with whatever injury he has, whatever issue he has with the knee, I expect him to also be available this upcoming weekend. Again, a veteran, not a true veteran, but experienced quarterback like Jalen Hurts. I expect him to possibly sit down most of the week and maybe return to practice by either like Friday type of thing. So don't be surprised if he doesn't practice today being Wednesday, he doesn't practice tomorrow being Thursday, but he's actually returned to the practice field with no restrictions and get the first team reps by Friday. If he does that, then expect him to play on Sunday.
Because I know Ian Rappaport said that he doesn't expect him to miss. There's a good chance he doesn't even miss practice this week. So I mean, from that report is and what you just said, it's a minor situation, and if he sits, he's doing it just to be precautionary. To be honest.
100%, exactly. So, like you're right. There's a chance that he will not miss any practice, but as a smart move for him and the sports medicine, they may give him a day or two off just so he can go ahead and rest, recover, and be able to ready to go. Now, if today's Wednesday, if he doesn't practice today, Wednesday,
They were off yesterday. Yeah.
Yeah, they were off yesterday. I expect them to be able to get a full practice on Friday to be ready to go for Sunday.
Walk through on Saturday and then
Yep, and then play, no restrictions whatsoever on Sunday.
Okay. Right. I mentioned Dwayne Brown.
Yep.
We can pass up on him. We can pass up on him.
Okay.
Who else did we mention?
We got DK Metcalf. We have two Seattle Seahawks. We got one receiver, DK Metcalf, with a hip injury, and we're going to talk about Kobe Bryant, I believe defensive back with the toe and shoe.
And then we're going to talk about the linebacker. So we'll just end with the Seahawks.
Yeah. Okay. So DK Metcalf, from my understanding, last week he injured they categorized it as a hip, and I think I was watching the game, and I noticed that he kept pointing to his front hip, almost kind of his hip flexor type of thing. Mm-hmm. So I wouldn't be surprised if he aggravated or strained his hip flexor muscle, which restricts some of your movement, or actually you experience pain when you're sprinting. So the hip flexor muscle is the one that, if you're sitting down or you're standing up and you bring your knee up, kind of like in a marching fashion type of thing, that's the muscle that kind of activates that motion. As a wide receiver, when you're sprinting, obviously you need to be able to get that leg up to be able to get that full range of motion, to be able to put the foot down and be able to propel yourself forward. So when you're having that discomfort, you're kind of almost limping out there. And I think you had mentioned something about that. You noticed that during that game when he came in, returned to play, he wasn't
against
himself.
The Bengals. Yep. No, we're not even talking about last week, but the Bengals specifically. Yeah, go ahead.
Yeah. So that's kind of what you brought up when you had mentioned Tortillas, and that you believe that it might have affected the Seahawks winning the game, or potentially wasn't himself.
Well, he stopped running his route. I mean, against the Bengals, to be honest with you, and it caused the interception right off the bat. So,
right. Well, and that's a perfect example. Like I mentioned, is that as a receiver, you can't lift that leg all the way up to be able to kind of push down and get that full speed ahead. So you're almost kind of just jogging out there type of thing. So you're not running your full route like you're supposed to, and then be able to cut and turn. So it affects your movement on that part. Yes, it's DK Metcalf. You can be out there. You kind of jog. You kind of, it's one of those questions. DK Metcalf at about 75% healthy versus another receiver that hasn't been playing type of thing. So I think he sat out this weekend. Now, a hip flexor strain, just like any muscular strain, assuming that's a mild hip flexor strain, can take minimum 10 to 14 days. So again, with him, it's just a matter of seeing how he progresses throughout practice. Again, he's a veteran receiver. There's no need for him to practice Monday, Tuesday, Wednesday, and Thursday. But if he doesn't return to a full practice by Friday, then I would be concerned as far as his availability for Sunday. So if you have DK Metcalf as one of your fantasy players, keep an eye on him specifically Friday. If he doesn't practice Friday, or he's still kind of limited on Friday, I'm a little bit concerned. If he's a full go for Friday, roll him out, put him on your lineup, ready for Sunday type of thing. Now, the other gentleman, I think one of the two is Kobe Bryant, I believe a defensive back or cornerback with the Seattle Seahawks. He has a toe issue. Now, one of the things with the toe is when you have most likely either has a sprained toe, what they refer to as turf toe. A turf toe isn't a big injury. It's a small issue, but it becomes very, very painful and discomfort in that area when it comes down to receivers and specifically defensive backs, because you need that toe to be able to push you forward, propel you forward. And anytime you kind of step on that toe, you're going to have a sharp shooting pain. I believe several years ago, about 4 or 5 years ago, Julio Jones was out with a turf toe injury for about 8 weeks type of thing. This is turf toe to a receiver or a running back or defensive back player or a linebacker is the same thing if, let's say, a pitcher gets a blister in the thumb. Most people think, hey, a blister in the thumb, you're fine. But a blister in the thumb for a baseball pitcher, that's it. They're done type of thing. It becomes very debilitating, even though the injury is considered very minute, very small, very minor type of thing. So turf toe can be painful, discomfortable type of thing. So I expect him also, because it doesn't allow you to move like you're supposed to. Now, the other gentleman, which I'm going to let you pronounce.
Chua, and I'm not even going to try to pronounce the last name. He's out for the season. with an injured pectoral
Correct.
muscle.
And your pectoral muscle, your pec muscle is pretty much your chest muscle up here. And what happens is that as the pec muscle is the one that allows your shoulder to come in. So if you ever do push-ups or if you ever do bench.